Low back pain is one of the most common reasons people seek medical care, but not all radiating pain in the lower body is caused by nerve root compression. Lumbosacral radiculopathy refers to neurological impairment, pain, weakness, or numbness arising from injury or compression of the spinal nerve roots. Classic signs include pain radiating along a specific dermatome, sensory changes, and muscle weakness. However, many musculoskeletal conditions can mimic these symptoms, making diagnosis challenging. For example, a patient with pain radiating down the leg might not have a herniated disc, but could be experiencing symptoms from hip osteoarthritis or even a muscle strain. Understanding the nuances of radiculopathy is crucial for accurate diagnosis and effective treatment, setting the stage for a deeper dive into its musculoskeletal mimics. Musculoskeletal disorders often imitate or coexist with lumbosacral radiculopathy, complicating the clinical picture. Hip osteoarthritis, for instance, can present as groin pain that radiates to the thigh or knee, closely resembling nerve root pain. Greater trochanteric pain syndrome, iliotibial band syndrome, and even hamstring strains can all produce symptoms that overlap with radiculopathy. Physical examination is key. While radiculopathy often shows neurological deficits like reflex changes or myotomal weakness, musculoskeletal mimics may present with focal tenderness, non-radiating pain, or pain reproduced by specific movements. Diagnostic imaging and targeted injections can help distinguish between these conditions. Recognizing these mimics is essential to avoid unnecessary tests and ensure patients receive the right treatment. Systematic approach to physical examination is vital for differentiating radiculopathy from its musculoskeletal mimics. Key maneuvers include manual muscle testing, sensory mapping, and reflex assessment. For example, weakness in ankle dorsiflexion may point to L5 radiculopathy, while focal tenderness over the greater trochanter suggests trochanteric pain syndrome. Evocative tests like the straight leg raise can indicate nerve root involvement, but their sensitivity and specificity are limited. Imaging, especially MRI, is often used but must be interpreted with caution, as many asymptomatic individuals show abnormalities. Ultimately, combining a thorough history, focused physical exam, and judicious use of diagnostic tools leads to the most accurate diagnosis, ensuring patients receive targeted and effective care. Summary: musculoskeletal disorders frequently mimic or coexist with lumbosacral radiculopathy, making careful evaluation essential. Recognizing these mimics not only prevents unnecessary tests and procedures, but also improves patient satisfaction and outcomes. By understanding the distinguishing features of common mimics, such as hip osteoarthritis, trochanteric pain syndrome, and hamstring injuries, clinicians can tailor their diagnostic approach. Combination of detailed history, targeted physical examination, and selective use of imaging or injections ensures accurate diagnosis. Ultimately, this approach optimizes care delivery, promotes resource stewardship, and supports better health outcomes for patients with lower back and radiating leg pain.